You're listening to the Turn Autism Around podcast, episode number 209. We are airing the first week of January 2023. So happy New Year. I'm glad you're with us today. Today, we are talking about a brand new topic called Gestalt Language Processing with Sari Risen. And she is both a speech and language pathologist as well as a board certified behavior analyst. She has done some training on the topic and has some suggestions for how to think about Gestalt language processing. So let's get to this really important episode with Sari Risen. All right, Sari Risen is with us, and I'm so excited that you are joining us today. Thanks so much for your time.
Thanks so much for having me.
Yeah, so we are going to talk all about a topic called Gestalt. I almost said it wrong. Gestalt language processing, and how it relates to echolalia and scripting and all the things. But before we dive into that very new topic for us, I'd like to start with your fall into the autism world and fall into the speech therapy world and behavior analysis world.
Okay, great. So I had my first interaction or my first sort of client when I was in high school. I was interested in healthcare and interested in working with kids. And so the idea of working with someone with special needs was really exciting to me. And I got to support this child with, at the time, there was the term PDD-NOS, and loved it. And then in university, I took my major was human biology, but I also took minors in linguistics and psychology, with the thought that maybe speech language pathology would be what I would pursue. And I really enjoyed the linguistics classes and the psychology, and it all combined kind of into being a good foundation for speech language pathology. So I started that, but my last year of undergrad and early in my graduate work, I also worked part-time in a job that where I got to learn ABA. So I kind of, got to tip my toe into ABA, and loved it. And I loved that it gave us a very logical and systematic way to do what I was learning to do in speech language pathology. So I thought at some point, I want to become a BCBA. There were not a lot of us back then.
And what year did you become an SLP, a speech and language?
So I finished grad school for SLP in 2007, and then worked for a while on a team at a center for children or for people with autism, on a team that had ABA professionals. No, we didn't have any BCBAs in the agency when I started, but so it was the ABA professionals were people that had some undergrad training in psychology or related fields, and I was the speech language pathologist, and we would work together. So I got to use ABA there, and in 2012 started BCBA coursework and finished that finished the whole process in 2013.
Okay, so you're both an SLP and a BCBA, and according to my friend Rose Griffin, who's been on the podcast a few times, we can link her in the show notes. This is episode 209. There's about 500 of you that are both.
Nikki Dower would know. She's got a list, Nikki, but it's something now, maybe 4 or something. I'm not sure if we're up to 500 yet.
Yeah. So it's a unique combination of an SLP and a BCBA, and it's a really great combination. Like, I cannot think of an SLP BCBA that I do not like or agree with. So it's a really unique, they call themselves unicorns.
Yes.
And it really is a great combination because using Skinner's analysis of verbal behavior, like, I can't think of any BCBA SLPs that aren't in favor of that. And it's just a really great combo. I'm a nurse and a behavior analyst.
Right.
And I know a few other nurses that are behavior analysts, but I can't name them. We don't have a little group.
Yeah.
And there's of course, tons of parents who have become behavior analysts.
Right.
And I did start like a Yahoo group way before Facebook. And I did write an article I can link in the show notes, the experiences of autism moms who become behavior analysts, a qualitative study. And that was actually in a journal like of speech therapy,
Oh, really?
ABA. It's no longer in press, but it's
Oh,
a great article, and I got a lot of ideas from this combination group. But anyway, that's a great segue into this Gestalt language processing. And I told you I actually got your name and information as being, somebody that would be willing to talk on the topic from Nikia Dower, because we're doing a lot of TikToks and Instagram. And if you're not following me there and you're there, it's at Turn Autism Around. But we're doing some things on scripting and stimming and echolalia and delayed echolalia. And so now we're getting messages about Gestalt language processing. And my son's a Gestalt language processor, or I'm looking for somebody who has expertise in this. And I'm like, I don't even know what that is. So can you tell me and our listeners what it is, why all of a sudden we're hearing more about it? And then, is it really a thing? Is it something different? Is it just what we're doing with a different name?
Okay, great. So yeah, when it first got popular, I don't know, maybe 2 years ago or about a year and a half ago, I was like, well, okay, are they just talking about kids who use scripts, kids who use chunks? So sequences of words that they've memorized? Because, okay, I've seen that. But why is this controversial? And also, why are people so excited about it? So I decided to watch Dr. Marge Blanc. She's the founder of this method, of this approach.
And how do you spell Blanc? B-L?
B-L-A-N-C. I could be saying it wrong. It might be my Canadian heritage that's getting me to say Blanc instead of maybe it's blank. I don't know.
So Dr. Marge Blanc, and I'm assuming she's an SLP.
She is an SLP, yes.
Okay.
Which her
Okay. So
PhD, I think, in
SLP. Coined this or started talking more about it and started studying it. Okay.
She's the one who started talking about it as an intervention approach, and she cites previous authors from the 70s and 80s who, in her approach, or according to her thinking, they got the idea of these Gestalt language processors starting. And I can go into a bit of that as well. Okay. So I watched a webinar by her, and there's a free webinar through the New Jersey ACE. I'm not sure what ACE stands for. I think it's a parent organization in New Jersey for people with autism.
Okay. We can try to find that and link that in the show notes.
Yeah. So that's the first thing I watched. And when I watched it, I realized, okay, it's not just that we're using these scripts sometimes. We're trying to encourage kids to use them more. There's more to it. And at that point, I became a little bit concerned about some of the aspects of it. So there's some great aspects to it. There's the idea that we really want to figure out what our kids love and what they're interested in, and be a detective and learn all about them, and that's amazing. And we want to make our interactions with them super fun and motivating, and we share that idea as BCBAs. But as I said, there's some concerning points. So first, the idea that there are some people who are Gestalt language processors, and that they learn differently than other people. This idea was started, Dr. Blanc talks about how it was first talked about by Dr. Ann Peters. I believe she was a linguist or maybe a psycholinguist. And so she wrote about how there is a continuum between people who are who use mostly analytical processing, so what we usually think about, so kids who learn a single word and then they start putting together 2-word utterances and move from there, versus people who use mostly Gestalt, what she called, did she use that word? I don't think she had coined the word Gestalt yet. No, I think she actually had. I can check that for the show notes though. So on the other end, there were kids who learned chunks of language, and she talked about that it's not that you're necessarily one or the other, you use both. And I don't think anyone would argue with that. Like, I certainly see that with my daughter. She'll, the other day she put on her boots and said, nice and warm. I don't think she knows the word nice. I don't think she knows the word warm, but her nanny had been saying their boots are nice and warm. And I think we've all seen that. We've certainly also seen that in our children and clients with autism. But the idea that this therefore indicates some difference in learning or a difference in what type of teaching a person is going to benefit from, I don't think we have evidence of that.
Right. And, it really does go hand in hand. That's why I'm getting a lot of messages, because I am producing things about scripting and delayed echolalia. And so even when I had Tammy Casper, who is another SLP BCBA on the show, we can link that in the show notes. That was all about apraxia. And, if you have apraxia and autism, yes, that is an additional, medical diagnosis potentially, or it is another, challenge. But in the end, the treatment is the same. So, we still have to go down to things they like and nouns, and then we build actions, and then we build, and we build articulation, and we work with a speech and language therapist to help us. So I kind of see this, and I have a son with autism, as you know, and I kind of see this as you have a child with autism or a toddler showing signs who's also scripting. But as Sari pointed out, your daughter does not have autism and she's 2. It's typical for kids to memorize songs or memorize cute little phrases or even memorize jokes from little things, and then to come out with scripts or things they like to say, Buzz Lightyear to the rescue. I mean, that's not like, oh my God, that child might have autism. I mean, these are things little kids say and sing and memorize and come out with. Kids with autism may come out with this sooner, more so than typical language, not like every now and again. It might be nonstop stimming and scripting. My son, for instance, before I knew any of this, before I had any inkling that there was anything going on with him, and way before I knew anything about ABA or verbal operants or anything, he would go to the park with my husband and I, and there was a sign there, please do not feed the ducks. There was actually multiple signs every 10 feet, please do not feed the ducks. So my son loved to run to the sign. My husband would read, please do not feed the ducks. And then he'd add quack, quack. So in the middle of the night, Lucas would wake up sometimes and say, please do not feed the ducks, quack, quack. I didn't know that was delayed echolalia. I didn't know that was a potential sign of autism. I didn't know how to get him to say it. And the other thing I did was, I was like, I'm going to count all those words as his bona fide words. Please do not feed the ducks, quack, quack. I'm like, there's 8 words. People count sentences when it's scripting. Mm-hmm. They like, it can force a parent like me into a state of denial, because when you get asked, are they talking in sentences? Oh yeah, they're talking in sentences, but they're scripts. And so it is concerning when people message me and say, well, my son learns differently. He learns through scripting. And then, can kind of, I just don't know how to respond.
Yeah. So here's the thing. So when it comes to language acquisition, we really don't know how language is learned. I know I have some fellow SLP BCBA colleagues who are really like, no, we know it's Skinner, but one thing I don't necessarily agree with that. I think Skinner gives us an amazing way to intervene when there's a problem with learning a language, but how we learn it naturally, what I learned through my language acquisition coursework is there's so many different theories, and each of them has its pros, but each of them also has its cons or ways to argue against them. And I think we're going to see the same thing, or we are seeing the same thing with the idea of, are there some people who learn language naturally through this NLA, natural language acquisition process, which involves Gestalts being learned first. So who knows what happens naturally.
So NLA is natural language acquisition, but that is that a part of, is Gestalt a part of that, or is NLA something that has been on for decades?
So NLA, Marge Blanc explains that NLA is this description of what happens with Gestalt language processors.
Okay.
And maybe that's true. Maybe it's not naturally. I'm going to leave that to the researchers. But what I think about the most is intervening when I need to help my clients with autism. And so I don't think we have evidence that teaching them in the way that the approach that Dr. Marge Blanc has described, we don't have evidence that it's likely to work, or that it would work. And plausibly, I think plausibility is a huge thing. I think we have a lot of things in our field, because we're a relatively new field, that don't have amazing evidence behind them. They have some, but they're plausible. This approach, there's a lot of pieces that aren't. So for example, rather than helping them to learn their first man, so someone who's got a lot of scripts but can't tell you, that they want water, rather than teaching them specific commands, the idea is you model more gestalts for them. So you model more of these sequences, and you hope that they will, what Dr. Marge Blanc uses the word, and it actually came from Ann Peters, that they will mitigate them. So they will take pieces of your scripts and then initially combine them with other scripts, and later on they'll parse them. So they'll pick out the specific words from them, and then be able to, in stage 3, really be able to put together their own 2-word utterances. And that's nice if that would work, but we don't have evidence that it would. And one reason that it doesn't make sense to me that just modeling would work is that modeling on its own, without the expectation that a child will respond in some way, is part of what we call indirect language stimulation. And the evidence for that is mixed with the autism population. And certainly what I see with my clients is just modeling really doesn't help. If it did, their parents have been modeling all along. So if just modeling worked, it would have worked. That's one of my concerns.
And one of my concerns, I've done a lot of talking about how I'm actually not in favor of things like carrier phrases to bump up the length of utterance. And we can link that in the show notes. And when you're talking about, the 2-word utterances, I don't talk about this podcast a lot, but I did a solo show after I saw an online lecture at the National Autism Conference with Dr. Vince Carbone presenting on language acquisition from a behavioral point of view. And we can link that in the show notes. That episode really goes deep into the language acquisition research. And he said, I'm kind of summarizing from memory, so I could be a little off, but you really want to get one-word utterances, then do your adjectives, adverbs, verbs, and then have the child put together naturally the 2-word utterances before you go messing with any real instruction on increasing length of utterance. Because if you push in scripts or that's or I want or I see, in my 2 decades of experience, that is going to hurt language more than help.
I agree. Yeah, you start to see them using it in places where it doesn't make sense because they're not quite understanding what it is. Yeah, absolutely. I follow more of what Dr. Carbone and you have described.
Yeah. So that is a concern, and I don't know the exact, you said stages or phases of this Gestalt, but I do think that we need to use kids' scripts as evidence that they can talk. We can measure their articulation just if they talk in little sentences, like "please do not be the duck, quack quack" wasn't perfect. It was like "please do not be the duck, quack quack," like that kind of thing. That's okay for a new talker. There's no reason to work on articulation with a 18-month-old, 2-year-old who's saying it like that. That's fine. But then we need to use that as clues, like he's highly motivated by those signs. He's highly motivated by text. He turned out to be hyperlexic as well, which I've done some work on. We can link in the show notes. But like you said with your daughter, nice and warm, she probably doesn't even know what that means.
Right.
So then pulling out, a picture of a duck for the shoebox program, or for matching, or getting a puzzle that has a duck and a pig. And, these are words that are not only highly motivating in our case, it was, but they're common first words of little kids.
Right.
And then you can work on, animal sounds, which are usually easy to say because they're just really sounds versus words. And, knowing just a little bit about Gestalt language processing, I feel like it's like trying to put a spin on something that doesn't really need a spin.
Yeah, I agree with that too. Yeah, you'll sometimes see the proponents of the approach talking about, well, I started to do this because I saw this child and he used a lot of scripts and that was getting in the way of his social interaction. I'm like, he's got a lot of other things going on with his social interaction. Let's focus on them. Yes, there's these scripts, and like you said, these scripts tell us that he can imitate language, so that's amazing. Because if a child can't yet imitate language, we can help them to learn to do that. There's great approaches to do that, but that's a whole step. If we can skip that step and just now the child's already imitating language, like we're ready to go.
Right. Imitation is such a huge skill, like you said. I know another good clue and way we used Lucas's scripts was he used to watch a lot of TV, still does. And one VHS tape that he really liked was called Arthur's Tooth. And in that episode, Arthur has to get his tooth pulled or something. And I guess he screams in pain from the tooth pulled. And then Lucas got his tonsils out and he didn't have any way to say he was in pain. One of my friends said in the middle of the night, your scabs might fall off and he might be in more pain. Don't panic. Just give him some liquid, blah, blah, blah. So, day 3 or 4 after his tonsillectomy, he wakes up yelling and he's yelling, Arthur's tooth, Arthur's tooth. And that to me was saying, oh my gosh, he's in pain.
Yeah.
And then after that, he would skin his knee and he would hold it and he'd say Arthur's tooth. So yes, we can use scripting and echolalia to provide clues. Even now, and now he can tell us, head hurts or boo-boo or whatever. But if he bangs his elbow, even now he'll say, are you okay?
Right.
But if he says, are you okay? People have to realize he just hurt himself. You know how when you bang your elbow, you're not like, oh my gosh, that hurt. So we need to continue to go like, hey, maybe we should try to replace that when he bangs his elbow, because I'm not always going to be there to go like, oh, that means he hurt himself.
Right. And yes, I think your examples show that he may have been using them communicatively, these utterances, likely is. And I don't think anyone argues with that. Like, I think way back when Dr. Ann Peters and then Barry Prezant were writing about this, it was thought that people had not yet thought of this being communicative, but it certainly can be. And I think we all agree with that. But yeah, it reminds us that we also need to give these kids a way to say these things that other people will also understand.
Right. So what do you do if a child is having a lot of scripting? Let's just say it's an 8-year-old with a ton of scripting, like as an SLP BCBA, how would you tackle that?
So I look at what else they have in their communicative repertoire. So I might leave the scripting outside and I'd be doing, like a Phoebe map assessment. Potentially, like it might be that we need to look more at other things like syntax, and then Phoebe map doesn't go much into that, but probably not. Probably if most of what they're doing is scripting, they're more at the level where we're looking at how's their manding, which is requesting, and how's their ability to label with single words. Okay, can they put together some 2-word utterances? I also would be looking at the receptive language, so their understanding of language, which in the NLA approach, you don't really see a look at receptive language.
That's huge, right?
Yeah.
Yeah. And we do, I don't know if you know, Sari, but we do have a brand new digital assessment. It only takes 10 minutes to complete and gives you scores in self-care, eating, sleeping, potty training, grooming, and dressing. A score in language, both expressive and receptive, as well as imitation and matching, and social skills, and then a score in problem behavior. So it is a really nice tool. You can get that at freeautismassessment.com. And it's basically my one-page assessment that I created like originally 18 years ago. And it's quick and easy as a real snapshot.
Oh, that's wonderful.
So in that case, yeah, I think you not only have to look at the language and the intraverbal subtest. I just did episode 205 with Caddy, who's a mom with a child with speech delay who's taken my courses, and her son's to the point where you really can do a lot with the intraverbal subtest, which is a BB map supplement. And so I find that the kids who script, it might get right to the point to do an intraverbal subtest on them and see.
Yeah, sometimes the scripting or the echolalia is because you've asked a question and they don't know how to answer it. So that would be where the intraverbal test would come in.
And that's a really good point as well. Is can you explain that? I mean, I'm totally on board with that, but I don't know that we've talked about that in the podcast. So you said sometimes the scripting is because you ask them a question that they don't know the answer to. Can you talk about that a little bit more?
Yeah, or I don't know if some people might call it scripting, but but you get immediate echolalia likely. So if a child has never been taught to answer what's your name and they're not a person who answers novel questions yet on their own, you say, what's your name? They're likely to say, what's your name? Because I mean, one thing that tells us, which is great, is that they realize they should respond. So yay. And now we need to give them the language to be able to respond.
Right. And I also have a client and a lot of experience with kids over answering yes when they don't know the answer. And also I was with this young man who went to like Catholic school and stuff. If he didn't know the answer, he would say God.
Oh,
or he'd
that's
say
so
yes.
interesting. Wow.
And so that's where the language comprehension is so important, and assessing quickly their intraverbal subtest. So we'll link Caddy's show in the show notes, but in her episode, in her show notes, we actually have the intraverbal subtest and where her son scored, and we talk a lot about that. But I do think that it's or they just start scripting when they don't know the answer. I had a client who would throw up a ball and say, stop throwing the ball. You couldn't like interrupt him, or if you asked him a question he didn't know, he would just script about something else. But it is a clue. And the intraverbals are always going to be, answers to questions are always going to be the hardest operant, no matter what age, ability, what language you're speaking. It's hard. There's
it relies on abstract thinking. Yeah.
And do you think that, in my experience, a lot of kids script heavily from videos, from YouTube, from VHS tapes, from DVDs? Has that been your experience too?
Yeah, absolutely. Yeah. And often they really enjoy doing it. So it wouldn't be something I would ever try to stop. I've had parents ask me, so because he'll say this long sentence that he's learned from the video, can we do something with it? Usually not. So if they're using it, they're not trying to communicate with you about it. They're just kind of walking around the room saying it. They're enjoying it. Doesn't really tell us much about their language other than the fact that they can imitate, which is great. But yeah. So I've seen a lot of kids get a lot of enjoyment out of doing that kind of thing. I've also had one client where he and his parents were really into like a drama and in a good way, like acting, and the arts. And so they knew lots of poetry and lots of movies, and they'd memorize the movies with him. And then it was great because they could socially interact by talking to each other with scripts. So yes, he also needed to learn to use language to be able to communicate with other people, but with his parents, this worked really nicely for getting sustained interactions. So that was great. And that is one of the things Dr. Mark Blanc talks about. And I do agree with her on that piece.
Yeah. I like that. And there's a really good older book that hopefully is still in press. We can link it in the show notes if it is. It's called Acting Antics, and it's all how to teach social skills through acting and scripts. And, so I do like that as well. You also, some of this too is kind of trickling into that presumed competence and what does presumed competence mean? And do you agree with that?
Right. Yeah. So when people say presumed competence, they're saying always assume that our clients have more to say or more, and that their cognitive skills are higher than what they might look like. And I say, well, I get this term from Nikki Adower and Tracy Lindblad, they came up with it. Presume potential, teach to competence. I think it's dangerous to presume competence when what we're seeing doesn't give us the evidence that the cognitive skills that we're hoping for are already there. The problem with it is that then we're not teaching at the right level. So we're missing teaching at this level, and this level might be where mands are being learned and where the child's learning to tell us what they need. If we miss that and we're skipping it because we think they're already here, we're failing them. We're not giving them the quality of life that they need. And then the other problem is, so this is actually a big part of the NLA approach. They say to look for hidden meanings. So in the Gestalt, for an example that Dr. Marge Blanc gives in the NJACE workshop is a child said to her something about Jiminy Cricket. In the movie, I think it's Pinocchio, he talks about that he wants to learn about his conscience. And so this child said this to Dr. Marge Blanc, and then she decided that he wants to learn about it, and so she's going to talk to him about it. And so time, I think, was being wasted in her session where she was talking to him about something that he probably wasn't interested in and didn't understand what she was saying. So I think that's a dangerous, and then another, I think, danger of it would also be what we've seen in the FC world, where children will say things or people will say things with their device, but it was actually said, by the person who was helping them to use their device.
And FC is facilitated communication.
Oh yeah, sorry about that. Yeah.
Now, just for our listeners who aren't familiar with all these, and I agree. Like if you test, Lucas's IQ, it is in the intellectual disabled category, and it is what it is. I mean, it's not really fair to give him a real IQ test because of his language impairments, and I'm sure he has potential and he is competent, but my 3 goals are he's as safe as possible, as independent as possible, as happy as possible. I don't really put a lot of thought into his cognitive level or even his language level. Like I want to get his words as functional as possible so everybody can understand him and that they know the meaning. But I do worry about this whole presumed competence, and like my child, Lucas's level over all the years, there's nothing to show that he would understand consciousness or he could go to college or he could, and it is kind of dangerous. And not to say that the Gestalt is a part of this, but this whole presuming competence and teaching too high, which we've both seen over the years, can really get you in trouble. And the other thing is, if a kid is scripting a lot, what are their problem behaviors? Because I had a kid who, said, "Are you happy?" Like during instruction, like I was the consultant and I went in and they're like, this new child is saying, "Are you happy?" 48 times in 10 minutes or 48 times in an hour. But when you didn't respond yes or no, or yes, he would have a problem behavior and it could escalate to aggression. So some kids script, they want you to repeat the script. They want you to, engage with them. And it can get into highly problematic behavior at school, at home, in the community. So, it's all well and good for everybody to go like, "Oh, there's hidden meanings and but like, where's their language? Where's their ability to request their wants and needs? Where is their independence? Where is their problem behavior level?" Because if we're not moving and teaching in that direction, it's not really, it is, like you said, like a waste of time.
Right.
Yeah. So I think that is, a good description. I mean, it is still a little out there, it's only been a couple of years. Is there any research on this Gestalt language processing that you know of?
Yeah, no, I looked far and wide in preparation for this because Dr. Marchblanc, when she gives her presentations, talks about, yeah, people say there's no evidence, but there is. And so I looked at what she said there is, and it's what I had talked about before. Dr. Ann Peters, what she had written was an explanation or a description of these utterances. And same thing with Dr. Prison. He gives you a couple of examples in his article, and he summarizes what Dr. Ann Peters says and a couple of other researchers. But again, it's not evidence that that this indicates any sort of language, and it's really not even a proper qualitative study. It's just anecdotes. And yeah, no, in terms of the intervention side of this, so does this approach as a package work? There's no empirical evidence. There's like Dr. Marchblanc has done a lot of work on writing up her case studies, but no empirical evidence.
Yeah. And I have found over the years, kids just do better when there's systematic programming. I use my assessments as well as then after that, the BB map assessment to really look at raising all the quote unquote good behaviors we want and bringing down the barriers and raising self-care and transitions. And it's hard work.
Exactly. I was going to say that it's, painstaking bit by bit, block by block, but you're going to get there. I think people are looking for like, no, isn't there like a faster, more fun way to get there? And what we do, I think, is fun, but like for the adult, isn't there a more fun way to get there? I don't think so. I think we have to do it in this scientific way that works.
Yeah. So you are in private practice in Ontario, Canada. You have a website, actionpotentialservices.ca. You mostly do in-person kind of work and consultation, so people can check out your website and contact you for information about that. I really appreciate your time. Before I let you go, part of my podcast goals are not to just help the kids, but help the parents and professionals listening have happier lives with less stress. So do you have any stress reduction tips or self-care strategies that you use to make your life happier?
Yeah, that's a tough one and so important, especially for the families. I guess what I do that helps me the most is I have a group of friends and colleagues that I can vent to and get feedback from, and that helps me to kind of keep things in check when I'm getting really stressed.
Yeah. I'm a talker too with my friends, so I appreciate that. All right. Well, thanks so much again. I learned some new things, and we're gonna link that webinar in the show notes for you to do your own research and just keep plugging along. We know how to help kids with autism and toddlers showing signs, and let's use these scripts and echolalia to give us clues on how to better teach and motivate our kids. And I think that that's the answer.
Yeah, exactly. That's the best message. Yep. Thanks so
All right.
much for having me.